professionalism on placement and what you need to know. So this has come from some feedback from students, lecturers and educators to say it's a topic they would like us to speak some more about. So hopefully you find today interesting. Firstly, just the content so you understand what we're going to cover today. So Jen is going to cover the CPAF assessment form and scene setting a little bit. I'm going to do some work on Mentimeter with you all. So if you do have an additional device like an iPad or an iPhone, then please have that ready for you. Iona is going to talk through a discrimination case study about a student, which is herself, and she'll tell you more about. We've got Rachel joining, who's going to talk from an educator perspective. So Rachel is one of our CSP stewards, but she also is an educator in her trust. And then we also have Charlie, who is a recent graduate, rotational band 5, who's going to give you her top tips as a student. We should have some time at the end then for more general Q&A, but do use the chat throughout, like I said, just to help you help us keep track of what questions we've got coming in. Okay. Just need to find my mouse. Over to Jen.
Hi everyone, I'm Jen. I'm one of the professional advisors here at the CSP, but I also take the lead nationally for practice-based learning. So I'm really excited to come and talk to you all today about professionalism. Basically, we want our students, we want our learners to get the most out of their placement experience, because that is some of the most exciting times I found as a learner, being out on placement, actually being hands-on, learning what the job is all about. And we want to get, we want people to get the most out of that experience. But we have seen a little bit of a trend recently in some students struggling to pass placement due to professionalism, or just kind of understanding what professionalism is. So that's kind of what's brought about the webinar today. And we're going to talk a little bit around professionalism, and hopefully you'll have a little bit of an understanding around it a bit more to take out onto placement with you. Next slide, please, Alice. Not sure if Alice's slides are still, whether we can move them on.
Sorry,
it's okay.
Trying. Let's just. Honestly, this is going to be the bane of my life today. You'd think it would be easier with more screens, but it is absolutely not. Okay, we're here. Okay.
There we go. So the aims of today are to understand what professionalism is and why it's important, to understand the expectation on students from what the CSP say, but also from the Common Placement Assessment Form, or CPAF. So apologies to the OT students in the audience. I know you don't use CPAF as a marking criteria, and also the HCPC standards, but also to give you some tools to get the most out of your placement. So there are two really important documents that you probably want to go away and have a little look at, and it explains professionalism in a little bit more detail. So I'm not going to talk through them in detail today because they're really easy to access and really easy to have a little read through. So if I'm going to tell you anything, when you take away this, go and have a little look at the CSP professional values and behaviours, and also at the HCPC standards of conduct, performance and ethics, because that's essentially where kind of the marking criteria from CPAF comes from, making sure that learners are able to meet those standards, because that's what's important, not only as a learner, but also as you move into as a registered practitioner. So when you've all graduated and you move into your registered role, then that, we need to be adhering to these standards. So professionalism covers many different topics. So it's thinking about it in a really wide sense. So things like consent, confidentiality, thinking about our duty of care to our patients and what that means, and when our duty of care starts and ends and how we do that. Thinking about our duty to report and raising concerns. And that is about speaking up when things go wrong. That's about being open and honest. And that's also about, if we spot something that's not right, how we raise that, and understanding our duty to raise these concerns. It's also about working within your scope of practice. And that means recognizing your limitations as well as knowing what you can do, and having those open discussions with your educators as well, so your educators fully understand what your scope of practice is, because it may be that you've done several placements before and built up a scope of practice that you can use those transferable skills fairly quickly on a new placement. But it also might be that you've never had experience in that setting before, and that actually you need to really recognize those limitations and work with your educator to build your scope of practice. But that's about having those open conversations. Thinking about your continuing professional development, your reflective practice, the learning that you take onto placement and the learning that you take away with you as well. Honesty, like I've said before, being honest when things go wrong, and that's really important. We're human. We're human. We all make mistakes. I've made plenty, but it's about being honest about it and taking learning from that. Thinking about appropriate ongoing referrals, making sure that we're referring our patients on where they need to go to. It's also about communication and how we're communicating in a professional way. So how we communicate maybe with our patients and our colleagues will probably be very different to how we communicate with our friends when we're out and about. So it's just thinking about what is professional for communication in the setting that you're in. How we manage risk. So we're going to come on to that a little bit more about thinking about risk management and what we need to think about, and kind of raising that with your educator as well. Thinking about how we delegate appropriately. Maybe we're working with support workers and we need to think about how we're delegating to them. And also promote and protect the interests of service users. How can we advocate well for our patients? How can we raise things when maybe there's inequalities that we spot within healthcare? So it's thinking about how we can protect the interests of our service users. So there's a lot in professionalism and there's a lot to think about on this topic. Thanks, Alice. So just to link it back to the Common Placement Assessment Form, because you know now that 100% of our universities across the UK are using the Common Placement Assessment Form for physiotherapists right now. So this is what you will be marked on. So it's really important that you're familiar with it and you know what you need to achieve. So the first point is fit to practice safely and effectively with an awareness of their limitations, scope of practice, and honesty about their role and consideration of ethical and moral matters. So really giving some thought into, like we say, what your limitations are, what transferable skills you bring with you, and having that honest conversation with your educator. Thinking also about ethical and moral matters. So it might be that the person who's now in your ward is actually a close family member. It might be there's a conflict of interest there. It might be that it's not appropriate for you to then go treat them or assess them. So it's thinking about things that might crop up and actually being honest with your educator about how you manage that. Promotes and protects the interests of others, following policies on consent, respecting dignity and promoting equity. Like I've already spoken around before, it's how you can advocate for your patients, how you're thinking about health inequalities, and think about how you're gaining consent. Well, it might be fairly straightforward, but it might be that that patient coming in is a child, or it might be that someone has dementia, for example. So thinking about how we apply then in the rules of consent in more challenging situations. Assesses risk and takes appropriate limit to limit harm to self and others. And this is really quite simple in terms of thinking about your manual handling, for example, thinking about the situation that you're in. Is it a home visit? Do we need to think about lone working policies? Do we need to think about for example, how well the patient is? What are their observations like if they're on a ward? Have they got their slippers on? Is the area around safe and clear to get them up and walking in? Has the cleaner just mopped the floor and the floor's wet? It could be any number of things that we need to think about. Reports reliably inform the practice educator of concerns of safety and putting well-being of others first. And again, this is that open and honesty. We need to make sure that we are reporting reliably, even if things didn't quite go to plan. That's okay. But what's really important is that we're feeding back openly and honestly to our practice educator or the people we're working with. Confidentiality is another big area and something that we all need to think about. So It's important where we're having those conversations about patients. Is it in a nice private room where we can discuss with our educator? We should not be thinking about these conversations as we're walking down the corridor in a hospital setting. We don't know who's behind us. And even if we're having that conversation and not mentioning names, someone's loved one might well be able to work out who you're talking about based on the information you're giving. So it's really important that we're maintaining confidentiality. Standards of dress, appearance and hygiene. Now, every organisation will have a slightly different dress code, possibly. They may have different rules on whether we're allowed polo shirts or whether we're in tunics. Find that information out before you go on placement, so you know what's expected of you, and adhere to that, because that is what the expectation will be of you. And same with punctual and has good timekeeping. If you can, try that route out to the hospital or wherever your placement is before you go. Try and make sure you know what transport you need to get there, and be open and honest with your educator. So, for example, when I started a job a few years ago, I knew that on a Wednesday I was going to need to drop my little ones off at nursery next to the hospital. So I knew it might be a challenge for me to get there to start at 8 o'clock. So I had that open conversation with my managers and we found a way around it. And the same goes for you as learners as well. That's really important that that you're having that open and honest conversation. So I'm going to hand over to Alice now, who's going to go through some scenarios with you.
On this question, if you could describe which best describes you, hopefully there's an option there for everybody to fill in. If anyone is having trouble accessing the Mentimeter, you'll see the details at the top. So mentimeter.com, and then the code 7889453. I'm going to just pop that in the chat whilst people are answering this question. You should be able to use this link to access it. Just give it a bit more time because I can see there's quite a lot of people logging in now. Okay. And if you can use the thumbs up button here when you've answered the question, then that's great. We're getting there with our numbers. I'm going to move on now just because we've got a few questions to get to, but you can add your answers afterwards. So the next question is, which uni are you linked with? So just to give us an idea of which universities we've linked today, you can use acronyms, but try and make it clear about how we're going to understand them, just so we can make sense. So we can see that there are some patterns forming. So we've got Wolverhampton, Oxford Brookes, Glasgow, Bedfordshire, LBU, York. Cool. So we really are hitting lots of different areas across the UK. Just give you a little bit longer to answer that one. Someone from UE, amazing. I trained at UE, best university going. Not that I'm biased. Fab. If you're not able to join the Menti, I will read out the questions and you can put your answers in the chat. So this question is just, which university are you linked with? So just to give us an idea of which universities we're reaching. If you're an educator and you're working as an educator at a NHS organisation, you can put the name of the trust as well. Okay, I'm going to move to the next question now. Next question is, are you a CSP member? So yes, no, or I plan to sign up. For those of you that have put no or that you plan to sign up, we'll make sure we send some information about that towards the end about how you can sign up. And hopefully this webinar will give you an indication of why you might like to sign up. So we don't always open webinars to non-members, but today we decided that this was such an important topic that we would want to open it up to all people. However, we do run lots of webinars that will be closed just to members, so bear that in mind. So the next question, what does professionalism mean to you? So just looking for a sentence or a word about what professionalism means to you. So a few answers for respect, honesty, being professional, equality, trust, high standards, showing up, being accountable, mature. Dressing appropriately, dignity, being on time, working within your scope, nice. Separating home life and behaviours from the workplace, acting like an adult instead of a teenager, being respectful, integrity, nice. Some really good words coming out here. Following policy and duties, communication, a role model, empathy, maturity, nice. Some really good answers there. Someone's put displaying the values and behaviours of the HCPC and CSP. Great, okay. I'm going to move on to the next slide. Again, you can continue to put your answers in if you haven't had the time. So we're now going to move on to scenarios. So this is a scenario where the student's bus has been late 4 days in a row now, making the student late each day. Is this acceptable, unacceptable, or are you unsure? And this is all about being honest. I will tell you the right or wrong answer, but it's all about the learning. So don't be afraid to put something different to what other people are saying. Don't go with the crowd. Put what you think, and then we can discuss afterwards. So we've got a few people saying acceptable, a lot of people saying unacceptable, and a few people saying unsure. Give it a little bit longer to have a few more votes coming in. So we've got 247 of you signed on to the Menti meter in total. Okay, I'm going to give the answer now. So the answer for this one is unacceptable. So the reasoning behind that is if your bus was late once or twice, we would probably say that's acceptable. But if it's late 4 days in a row, at that point, there would be an expectation that you get the earlier bus, if that's possible, to make sure that you're able to arrive to work on time. So whilst there is an understanding that public transport can have delays, it would be the expectation for you to understand that it sounds like on the fourth time that the bus is going to be late most days or often, and it's then up to you to kind of think about getting that earlier bus to make sure that you can arrive in work on time. So I think for that one, it's the 4 days in a row really that should be an indicator. At that point, we would expect you to be getting a slightly different bus. If, for example, there wasn't an earlier bus that you could get, then it would be about having a conversation with your educator to ensure your educator understands that maybe that's the first bus of the day. If it is late, it has a knock-on impact for your connections, for example. But we would absolutely expect, after being late 4 days in a row, for there to be a change in the bus time you're getting or a conversation with your educator to explain why a change in bus time may not be possible. So well done to the majority of you on that one. And hopefully for those that have put acceptable or unsure, that's kind of cleared up that scenario a little bit with some clarity for you. So the next question, a student asks if it's okay to have a phone on them during the day as they're expecting a call from landlords about dealing with a repair to the bathroom. Have a little think about that one. So most people at the moment are saying acceptable. We've got a few unacceptable and a few unsure. Share the answer with you on this one, but do continue putting your answers. So this one would be acceptable. Because you've asked for permission and you've said that there's a reason why you need to have your phone on you. Hopefully you're still respecting the fact that having your phone on you means that it's not on display. But life happens when you're adulting. Definitely when I was a student, I ended up having lots of issues with my student accommodation. As long as you've asked for permission and gave a reasonable reason as to why you need your phone on you, it's likely that the educator would be okay with that and that you would get that permission to have your phone on you. Because there is times in life where you do have to have access to your phone. It could be other reasons. It could be that you have a child that's gone to nursery that's unwell that you need to be able to answer the phone on if they do need you to come in. It could be you've got a family member that's unwell that you need to be kept in the link with. In this vein, I think if you've asked and kind of had permission, then it would be seen as acceptable behaviour on that one. The next one is, whilst a supervisor reviews the student's notes, the student gets their phone out and starts to read WhatsApp messages and respond to them. Is that acceptable, unacceptable, or unsure? So most people are coming in here saying unacceptable. I've got two people that are saying acceptable. So this one's a bit more clear cut in people's mind, it seems. Gonna give the answer now. So this would be unacceptable. Even though it might be kind of that time where you're not necessarily doing much because your educator's reading through your notes, it's just an understanding that it would be unacceptable in that period to have your phone out and be on your phone. Um, it's not responding to WhatsApp messages isn't something that should be done kind of in that downtime. It could be that you're engaging in conversation with the educator whilst you're doing your notes. It could be that you take the time to make some notes about some reflections you might want to do. It could just be that you take the time to just kind of sit there and wait. But I think the key message here is getting your phone out in those moments wouldn't be acceptable. And I know we're in a society, for example, where you do have 5 minutes downtime, you might pick up your phone and go on it outside of placement and work. But it's just that acknowledgement that in the workplace, that time that isn't being used with patient contact, we would see it as unacceptable to be having your phone out and be playing around on it in those moments. But acknowledging that it's different if you've asked for permission to be on your phone for a specific reason, this one's just kind of responding to WhatsApps. But well done, the majority of you were able to understand the difference there. So this question, a student turns up to placement wearing shorts with a polo top. Is it acceptable, unacceptable, or unsure? A lot more people voting unsure with this one. If you have access to the chat, you can pop in why you've put unsure maybe, given that a lot of people are saying unsure. Yeah, Elizabeth Jones is spot on for this one. So the answer is unsure because every workplace will have a slightly different uniform policy. So we know that some trusts do allow physios to wear shorts and some trusts don't allow physios to wear shorts. So it would be a case of if it's in keeping with the uniform policy, then that's a-okay. But if it's not in keeping with the uniform, then it would be unacceptable to wear something that is not in keeping with the uniform policy of that trust. So just a reminder really of when you are starting a placement, you could ask for a copy of their uniform policy just so you understand what would be acceptable to wear and what wouldn't be acceptable to wear. So shorts is just an example because I know it's something that often does come up as contentious in the summer, but it could be the colour of trainers, it could be whether they wear tunics, it could be that they wear smart casual clothes but not uniform. So it's always worth touching base with your educator in advance to understand what are the policy of the place that you're doing your placement at. So this question, a student tells the educator that they need the 28th of October off placement as it is their 21st birthday. So there's a few coming in for acceptable. That's creeping up a little bit. We've got 120 unacceptable and about 10 people that are unsure. Give it a tiny bit longer for people to bring in those votes. Okay. So for the answer for that one, it's unacceptable. So it's the language really here that's important to pick up on. Is as a student, you're not in the position to tell people that you need days off unless it's for specific circumstances, and a birthday wouldn't come under those specific circumstances. If you'd asked about having the day off, then that would be acceptable because, of course, you're entitled to ask. But kind of demanding it or saying that you need a day off for reasoning such as a birthday would be deemed as unacceptable in terms of your kind of professionalism and behaviours. Um, I'll go into a bit more detail after the next one. Some of you have already answered this one because I think I started with this one on screen. But a student is pregnant and they tell the educator that they need to have the 28th of October off in the morning as they have a antenatal scan. So most people are saying acceptable, a few are saying unacceptable, and a few people are unsure on this one. So the answer for this one would be acceptable. So it's just that difference in the reasoning about why you'd be having the day off. So if you are pregnant, you're protected by policies. It's a protected characteristic, being pregnant, and you're covered by employment law. If you're a worker, which we would expect to be the same as a student, which is basically you have a right to attend those scans linked to your pregnancy within work hours. And you're kind of using an informing mechanism rather than a request and ask mechanism. So you're informing them that you have an appointment that you'll be attending. It's important that they know that you are attending and they are expecting you not to show up to work, but you're not requesting in terms of a accept or decline request because they wouldn't be able to decline you attending an antenatal scan appointment. So the wording is different on that one, and there may be other reasons why again you'd be informing rather than requesting, but it's just thinking about the reasoning that you're using on that one. So the next question, a student takes a Snapchat video whilst on the ward and sends it to their close friends. Is that acceptable, unacceptable, or unsure? Lots coming in very quickly here with unacceptable. But one person acceptable. Nobody's unsure so far on this one. I'm not sure even whether Snapchat's the same kind of social media that you'd use these days, but I think it's still used quite widely. So this one seems pretty clear cut in people's head as unacceptable, which of course is the case. So each trust will have a social media policy. The main points for me is that anything where you're in uniform and identifiable as in uniform puts you at risk. If you're filming in a ward environment, you have to really consider what kind of confidential information you might be sharing. So you hear of cases where people will be filming a video of themselves, but in the background there's the ward chart that's got the name of the patient, what's wrong with the patient, when their expected discharge is, and that's super confidential information that you might in kind of accidentally be sharing with the general population, which would absolutely be a GDPR risk, and you break in confidentiality of patients. But it's also, it's thinking about what you're doing in the video. Are you being unprofessional in your uniform? Are there other people in that video that haven't consented to be in that video? It's something you have to be really, really careful of. There's very few acceptable scenarios where you'd be able to film yourself during work hours. So I think it's something that I would really, really recommend that when you are on placement, you just take some time to look at the social media policy of that trust, or ask your educator. But I think it's starting to get into the habit of understanding what's acceptable and not acceptable about social media use in the workplace. Because it can even be things like just posting, posting on Instagram whilst you're in work. Is if you're in work and you're using your phone and it's outside of your break, that's also using work time to be on social media. It's a really complex area. We do have a specific CSP kind of guidance on this, and the HCPC has guidance. So yeah, just worth reading up on before you go on placements. That is the end of that part of the presentation. So thank you all for participating. Really helpful to hear your thoughts, and hopefully it's made you think about some of those scenarios in more detail, and think about what you might do in the future if any of those scenarios come about. Okay, I'm going to hand over to Iona.
Hi, thanks, Alice. So my name's Iona, and I'm actually a CSP student officer, but also a final year BSc physio student as well. And I just want to share a bit about my experience with disability and discrimination, and also how to approach that in a professional manner. So I actually got a hand disability and ADHD, so kind of coming at from a physical and neurodiverse perspective as well. So we go on to the next slide. I'm going to talk a bit about difficult experiences that I've had and that peers of mine have also had. So one of those is non-disclosure. So if you do have a disability, you might not be aware that your university can't actually let your placement know usually. It's a GDPR issue, so it's really important to let them know yourself, but I didn't realise that on my first placement. And I also didn't understand how my disability would impact me in that different setting. So I had lots of support at university with a reasonable adjustment, but you're going to a whole new setting that you might not have worked in before. So I didn't understand that fully when I started. I also didn't even know I had ADHD. I only found this out in my second year. I think that's quite common for people going to university and suddenly realizing, they've managed to get through, high school or secondary school, and it's not until they get to university that more issues kind of become aware. So I had that issue. I also had discrimination on placement, and that kind of led to a breakdown in communication. I actually failed midway, which was pretty devastating. But just to give you guys some reassurance, if that happens to you, reach out for support. I'll talk about it a bit on the next slide. But I did get support from my university in the CSP and had a really positive outcome. I actually ended up getting a first, and I learned so much from that difficult experience going forward as well. So I kind of want to share with you all the positives that I took from that and what I would do going forward in my placements as well. So if we go on to the next slide, we've got some details of that. So if you've got a disability or any kind of thing that's going to impact your learning, to be honest, the best thing to do is contact your supervisor as soon as you have their details. In fact, I would kind of set up a template email right now, kind of detailing your disability, how it impacts you, the kind of support that would be helpful, just to have that ready to go off once you get their details. And my biggest pro tip is to spend a day in the department if you can, or have a Teams call if that's not possible, because actually being in that environment and seeing how you're going to work, how your needs are going to be met is really, really valuable. And also you're not being assessed at that time, so you can ask all the questions you need to without being worried that's going to impact anything. Also for assistive technology, if you use it, so I use Dragon software, especially if we're going on an NHS placement, it can take quite a bit of time to get those adjustments in place. So do make sure you get that in as quickly as possible as well. And we have a guide to welcoming and supporting disabled learners on the right. That's meant for learners and supervisors as well. So I would recommend having a really good read through that. And probably my biggest tip is join the Disability Network. We actually have 3 diversity networks, the LGBTQI+, Disability and BAME, and they're great places to kind of share experiences you're going through. I got so much support. So having a hand disability, I didn't know how I was going to take notes, for example, and I managed to connect to other people with hand disabilities who said, like, use a portable printer or a label maker in that way. So I would never have known all that great advice if I hadn't been part of that network. And on the next slide, we have a bit about the CPAF learning agreement and the SWOT analysis, which is really important as well to have this ready for your first day. And what this really allows you to do is to let your educator know all the ways that that you worried that you might be impacted or that it might affect your learning, and then you can work through that together to get a really good plan in place to support you. And I'd really encourage you to use the SWOT analysis, especially your strengths. So having a disability, you will naturally have so many amazing transferable skills to support you as a student and a physio, and it's really important to highlight those. So they can be things like empathy or, solving challenges and problem solving, being creative, having resilience, determination. All of these are fantastic skills that you are naturally developing moving through the world with a disability. So definitely make use of that. And moving on to the next slide. So when you actually start your placement, it's really important to keep that communication going. And although I said to disclose your disability, it isn't actually mandatory, but I would say, if you do start running into difficulties due to a disability, if you haven't disclosed it, they're not going to know how to support you, and it could run into more difficulties. Also look up within your trust. They might have different support for disabled students and employees, like groups that you can go to for support. The link on the right is to the NHS Employers Health Passport. I found this really useful just to work through to help me identify what to put in that learning analysis on the CPAF form. And also really regularly reflect on what's working, because when you start your placement, it might be very different to the midpoint or end where you might be given different tasks or work in different settings that you're not used to. So a reasonable adjustment isn't like a once and done process. You're like constantly learning as you go along. And on the next slide, I'll just go through what to do when things don't go so well. So hopefully this will never happen to you. But if it does, before you have a conversation with your educator, really reflect and identify the challenges that you're having, their impact, and any potential solutions, so that when you have that conversation, you can show that you've been proactive and you've come with a solution-based focus. And you can also consider having a joint meeting. So you might have someone with your university there to support and kind of mediate in that setting. That really helped for me. And also do remember to remain professional when you're seeking support. So if you're having conversations with your peers or in group chats, it's really important to remember that you still have to remain professional, and it's not advisable to talk about any difficulties you're having in those kind of group or public settings, a bit like Alice and Jen were saying earlier. And also look to your university. They will have confidential wellbeing services that you can go to for support. And as I did, learn from your experience to see how it can benefit you in the future, but also other students coming after you as well. And on the right there's a scan to a paper, which is how to give and receive feedback effectively, which I really wish I'd read before I had that difficult placement. And finally, on the last slide, I just want to highlight a really great benefit to CSP student members. This is a new benefit we brought in this year, which is the wonderful Jess Sainsbury, who's our student support officer. So if you are having any difficulties on placement or at university, you can get in touch with Jess. She'll give you confidential third-party advice for how to get through these issues and how to have those conversations with your supervisor or your university. So I definitely recommend seeking out that support if you can. And I'll also put some links in the chat as well. But thanks so much for that very brief overview. Also, please do reach out to us at inquiries@csp.org if we can help you in any way. Thank you.
Thank you very much for that, Iona. I'm going to hand over to Rachel now, who is one of our educators.
Hello, hi there. So my name's Rachel, guys, and I work as a senior neonatal and community children's physiotherapist. So I work in Coventry, and today I was just going to, go over the educator's perspective on professionalism. Could I have the next slide, please, Alice? Thank you. So I wanted to start on, the positive experiences that I've had. And it's mostly been when students have, really built that rapport with the educator, the patients, and the families that they work with, while keeping into consideration any of your, cultural sensitivities or inclusivity issues, because what I do find is it helps me as an educator to give them constructive feedback and for them to also take it on. um, and at the end of the day, if they have a good, growth mindset, they want to change after they get, feedback. It really helps us as a team on, when we support those students on placement. It not only helps the student with, their resilience while they're on placement, but we do find that, when they go out later and become professionals themselves, it really helps them later on too. And as educators, when we do find our students coming back into the team, we find that it's so nice to see them as learners and later on as, confident practitioners or clinicians. It's a really nice experience to have. Could I have the next slide, please? Um, from an educator's perspective, I do feel that, it's better to have that, the modeling type of behavior. If I want somebody to act a particular way or for them to do something, I should also, practice what I preach and lead by example. This then, kind of helps create that safe environment for me to give the student feedback and, vice versa, for them to just, ask me questions without them thinking that I'm going to judge them. And, it helps me as an educator as well to give the student specific feedback, because what sometimes does tend to happen is if I've given them a feedback from, I don't know, 2 weeks ago and, they've improved, sometimes then it's taken in a bad way that, oh, I've not done this, I've actually done better. So it actually helps the educator and the student give nice, timely, constructive feedback. What I find is quite important is, you know, setting that time out, even as an educator, for you yourself to, have these discussions with your peers, because maybe there's somebody else who's also had that same issue with their student, or maybe how they themselves as educators give feedback. So it's a nice way for us to learn off of each other. The next slide, please, Alice. Thank you. One of the few, common challenges that I have seen. The first two, I would say I haven't seen as much, but I would still like to, touch on it today. Is when sometimes there's a fine line between, how casual you can be with your educator. Yes, they are there to listen to you, and they can give you advice in a friendly manner, but they aren't your friends, if that makes sense. uh, so, um, it's a fine line. I know there might be some people who speak a certain way. Like I would be absolutely fine if somebody asked me a question in a friendly manner. However, not everybody is the same. So I would just say be quite aware of that. And when it comes to things like punctuality, your dress code, those are things that really leave long lasting impression. So I would say be quite mindful when you're on placements. The rest of the other 4 points, sadly, we do tend to see it quite often, where our students do sometimes lack the confidence to engage with the patients or their families. And because we work in a children's setting, sometimes it becomes a little bit difficult for them to maybe, change the tone in which they talk or the language that they use with our kids. because it does vary when you talk to an adult and when you talk to a child. Because you can't tell you can't tell a toddler, give me a squat. You would always have to say, things like, oh, could you, pick up the ball for me? So there are like different ways of doing that. And what we do see is then the students get a little bit dejected at themselves that they cannot be part of that team or be part of that whole experience. So, of course, as educators, we don't want our students to be in that place, which is why I really like asking my students what their learning style is just before the placement, just so that if need be, I have enough time to make arrangements for them. And equally, if they need to receive feedback in a different way, I can arrange those things for them. Um, so I would say keep having those discussions, just like Ayana said, have those discussions with your educators, with your CSP, with the reps, maybe in that trust. They are there to help you. We want you to succeed. Could I have the next slide, please, Alice? I would just like to leave you guys with just, three reflections from me is that professionalism is developed over time. It's not something, it's not like a, one trick thing that I can just be like, yeah, you can do this. So it comes as you make mistakes and you learn from them. And, if you've been given good advice in a nice guided way. And at the end of the day, a placement is is like a shared experience. If you give your educator information of how you would like things to change, they can also then help you. So I would say just ask. We're all human, we all make mistakes, and we'll then only be able to help each other. Thank you.
Thank you very much, Rachel, for that. I will pass over to Charlie now, and hopefully we'll have some time at the end for some Q&As with all of the speakers.
Hi guys, I hope you can all hear me. My name's Charlie. I'm a Band 5 rotational physio in the NHS. I qualified coming up to a year ago now, so I was very recently a student. So I'm here to kind of give you my kind of top tips to not only meet those professionalism requirements with the CPAF, but also to exceed them and demonstrate those behaviours required to become a good physiotherapist. So I'm kind of going to roll off the tongue here. I've not got any slides, so if anyone wants me to repeat anything, just let me know. So I've split it into a couple of sections. So the first being around punctuality and reliability. So First thing that I would mention is making sure that you're arriving early to your placement, not just on time. And the reason why that is, especially if you're going by public transport or if you're traveling by car, you want to be compensating for any delays such as traffic, or, if the bus or the train is late, then you know that you can make that time up and still, arrive on time. Obviously, if that doesn't end up being the case, that is absolutely fine, as long as you're informing your clinical educator, and as long as it's not continuous and it's just a one-off on occasion thing. The second thing that I would say is to come prepared. So at the very least, I would come with, if it's appropriate, an ID badge and a pen, so that your educator knows who you are and that you're prepared in the sense that, when you come to writing notes and things like that, you're ready. And also asking your educator how to arrange access to things like clinical systems if it's necessary, and I would do that on first contact. I would also, again, similarly to what I just said, informing your educator if you're running late or unable to attend due to illness or personal matters. I would not just inform your university. So obviously when you are off ill, they usually tell you to contact the university to let them know that you can't come to placement, but you also need to be letting your educator know, because they're, at the end of the day, they're responsible for you. And if you don't turn up to placement and you don't tell them, they're going to be worried about you, and that's when it becomes a bit of an issue. So the best thing that you can do is, when you make that first contact on email, ask for an appropriate contact number so that you always have that ready if you need it. So the next section, so dressing and presenting yourself appropriately. So again, adherence to the dress code, making sure you follow the hospital policy. Again, you can always ask your educator to clarify what is appropriate for their dress code and what is not, so that you can make sure that you can follow that appropriately. The next one that I would say is to obviously ensure your uniform is cleaned, ironed and presentable. And that not only does that make you look more professional, it also, from an infection control perspective, means that you're upholding that policy as well. Maintaining hygiene, similarly to the last section, making sure that, you know, after every single placement, that you make sure that you're washing your uniform, that you're getting, you know, showered, because again, making sure that you're adhering to that infection control policy, and making sure that you're presenting yourself appropriately. And again, refraining from wearing jewellery, ensuring long hair is tied back and that nail polish is not worn. And that again is about adhering to infection control, and again, looking professional. Onto the next section, so maintaining confidentiality. So I would not discuss patient information outside of clinical areas, and only discuss with the relevant professionals that are involved with their care. So that's things like not discussing patient information outside of hospital corridors or on public transport, or outside of the hospital. Again, even if you're trying to pseudonymize information, it is still very sensitive information. And again, loved ones can work out you know, who you might be discussing, and it comes across as unprofessional if you're sharing sensitive information outside of those clinical areas. Following institutional policies on record keeping and data handling, so using kind of confidential waste to get rid of any any paper kind of waste that might contain clinical or confidential information, making sure that you're storing data on the IT systems appropriately, and keeping clinical notes within the appropriate ward. So it's not appropriate to take any sort of clinical notes off ward. And then also being cautious when posting information on social media. So Jen very kindly put the kind of guidance to social media in the chat on the HCPC and the CSP. So what I would typically avoid, especially when you're because I see a lot now where I've got a few friends myself that have kind of social medias dedicated to kind of their physio progression and their career, which is obviously great. But things that I would avoid mentioning trust or hospital that you work at, not posting pictures of or in clinical areas, not discussing any detailed case studies online, even if information is kind of anonymized or pseudonymized. Again, because it's that very sensitive information that you're kind of sharing to the general public, and that can come across as very unprofessional. Showing initiative but knowing limits, so kind of this relates to kind of working within the scope of practice. So contacting the department before starting placement. So again, a lot of the time when you get the area that you're working within, making sure that you kind of make first contact before you start, just so that you're aware of kind of maybe working hours, what's maybe to be expected of you, any pre-reading that you can be doing, or how to even to find the department, so that then again, when you're on your first day, you're not wasting time trying to find where you're going. Pre-reading or researching the clinical area, even if asked to. Again, this is about kind of exceeding those professionalism expectations. Even though you might not be asked to by your educator to do any pre-reading, it's always good, especially if you're going into a new area, just to kind of get a feel for kind of what you're going into. And again, it kind of helps it'll help with your kind of progression alongside your placement. Asking for opportunities. So this is about kind of being proactive. Again, if you've got your specific learning opportunities, specific goals that you're working towards on your placement, you want to be asking for those opportunities to meet those goals. So that might be to lead assessments, to practice treatment or interventions, shadow others, or kind of present ideas. And again, that's going to widen your scope of practice. Reviewing notes and preparing to see patients ahead of time. Again, just being proactive, doing things that you're able to without having to have your educator supervise you. And it kind of helps you kind of prepare for when you do go to see patients. And then the last section is kind of working well within the immediate and wider team. So making sure that you're being polite to all clinical and non-clinical professionals, as well as patients, and that you're speaking to them and communicating with them appropriately. The next thing that I would do is be a team player. You're obviously, when you're on your placements, a lot of the time you're going to be working in a team of multidisciplinary professionals. So if you ever find that yourself kind of, you know, not knowing what you're doing next and you kind of have a bit of dead time, I would always offer help, or share resources, and also show gratitude for your learning. Because again, that's going to show that you're really, you know, willing to help out, willing to learn. And again, that'll help kind of exceed the expectations of kind of the professionalism aspect of the role. And again, understanding the role of the multidisciplinary teams. Again, that's kind of in relation to kind of appropriately refer, if you've seen a patient and you know you think that they benefit from input from another team. Again, knowing what their role is means that you can appropriately refer and make sure that they get seen by that other professional that's not obviously within your scope of practice. So they're all my tips. So thank you very much, Alice. It's me done.
Thank you, Charlie. That is excellent. Thank you for your top tips.